Made progress in reducing hunger since 2000. Progress has been uneven, with levels of hunger still serious or alarming in 51 countries around the world. South Asia and Africa south of the Sahara have the highest levels of hunger. Tatiana von Bornman, lead programs and innovation from WWF South Africa, is on Skype with us. A very good evening to you, Tatiana, and thank you so much for speaking to us. Do we have the latest figure on this?
Yes, so in South Africa, our figures are really concerning. After many years of consistent good performance in terms of our food security in this country, we've seen a decline since about 2015, and hunger and poverty are very closely welded. So as our poverty rates have increased, so too have hunger rates in South Africa, to the extent that at least 22% of South Africans are considered food insecure.
So how many countries in general have populations in which at least 1/4 of the population is undernourished, and do we fall under this category?
So I can't tell you how many countries fall into that category. I can tell you that we fall out of that category, but we shouldn't allow that to give us a sense of undue comfort. We have a hungry nation in this country, and it's hitting our children, the under fives, most significantly. So I think, yes, we can look on a global scale where you hear these stats like 1 billion people overweight, almost 1 billion people underweight and hungry. But when you look at our own country, you see similar statistics reflected, and overweight often masks poor nutrition and hunger. People are overeating the wrong things rather than simply overeating because of the ability to access good food. That's not the case in this country at all.
So we'll talk about those multiple forms of malnutrition, but let's just stay with under fives. How many, or what's the percentage affected by or facing chronic malnutrition here? And are they still being killed or die as a result of malnutrition?
Yeah, thanks for that question, because it's a really important one. And I think this hidden crisis in our country, when you consider that at least 26% of children under 5 in South Africa suffer from some form of wasting or stunting. And stunting really means that the chances of them reaching their full mental or physical potential are very low. You realize this is a serious crisis in a country where we're fighting for free tertiary education, when 1/4 of our population will never have the opportunity to access that because they've been denied either neonatal nutrition or in those vital first 1,000 days. They're going hungry.
And the awareness around stunting and its effects, is it widespread enough?
I think the answer to that is no, simply because not enough is done in a collective way to address it. So World Hunger Day is this effort to say, we've got to think about it. We've got to think about it in form of collective action. We've seen this breakdown in trust between our Department of Health and the government and the private sector. We've seen a fragmented effort to address this, but not the necessary collective concern, I think, that we need to turn the scourge around, because it's not actually just about food. It's about poverty. And there's a very strong gender disparity here, where it's women and girl children that seem to present the most significant levels of deprivation.
And I'm glad you raised that point, because I'm wondering, in tackling the scourge, are there any plans to give women farmers, for instance, resources to be able to overcome some of these challenges?
I don't think that there's enough evidence of that kind of gender lens on this. I think there's a collective response which is treating everybody equally. And I think that's the role of World Hunger Day, is to recognize that it's 60% of those going hungry are women and girl children. That there really is a disproportionate impact on women. And therefore, strategies should have a very clear gender lens. And I don't think we have sufficient evidence of that in South Africa.
So let's talk about another phenomenon which has become very real and popular in terms of the lens we apply to some of our problems, and that's climate change. Can we talk about what the situation is here in South Africa, climate change and food production?
So there was a very important study that came out in February this year, the Eat Lancet Food in the Anthropocene, which looked at how diets connect human health and environmental sustainability, and looked at what are our chances of being able to feed 10 billion in 2050 with our current practices and with all those malnutrition and overnutrition challenges that we currently face. And there's no doubt about it that if we don't change the way we produce and change the way we eat, we are not going to be able to address the very real impacts that the food production approach has on the climate, and similarly what the climate does to our ability to sustainably produce food. So there is this focus in World Hunger Day around sustainability and how do we produce in such a way that we are working in harmony with nature and decarbonizing our production system.
Tatiana, just before you go, just a final question on what you spoke about earlier on the multiple forms of malnutrition that coexist, such as high rates of child undernutrition, but also adult obesity. So how are we dealing with that situation in South Africa? Because it is really ironic that we have that coexisting.
Yes, and I think this is a very real evidence of a collective failure in our food system. I think there is responsibility, with all stakeholders. And the challenge is that our malnutrition is certainly the overnutrition side of it is because we've shifted to a westernized diet. We are really enthusiastic consumers of highly processed, high fats, high sugars, increasingly adding protein to our diets beyond what is healthy for us. And then we've got the flip side of that, which is where people are overeating maize products simply because that's all they can afford. And so their obesity is a reflection of malnutrition. So these are such complex issues. And I certainly think we've seen evidence in national government and provincial governments to really try and understand this. And a big driver for that is this is now the major killer in South Africa. These lifestyle and diet related diseases were responsible for 5 out of every 10 deaths in the Western Cape last year. So it's urgent.
Thank you so much for speaking to us and sharing your insights. Tatiana von Bormann, Lead Programs Manager and Innovation from WWF South Africa.